Hey Defy Nation, this is Danielle. Now you guys all know that I'm an avid cyclist and the love of cycling has only grown from my first spin of the pedals. Because of my love for the sport, Richardson Bike Mart is my only choice when it comes to equipment, accessories, and the most knowledgeable cycle experts in DFW. Their massive selection is only outshined by the extent of cycling expertise and caring by the staff. Remember, choosing a bike is personal and precise, so make Richardson Bike Mart your only choice too. Visit them today in Frisco off John Hickman Parkway, Dallas off of Garland Road next to White Rock Lake, or the Richardson location at Campbell and Coit. Check them out at bikemart.com. That's BIKEMART.com.
We could be
What's up, Defy Nation, and welcome to another episode of Define Your Health with Danielle Girdano, strength through knowledge. And I'm so excited when we have a chance to do this. You guys spoke and we listened. We have back again for a second time our very special guest, Dr. Patel from Baylor Scott & White Orthopedics of Garland. And you may remember he was on a couple of months ago, and you guys just loved him. And so you had all these wonderful questions, and it was just too much for one of our fan mail shows. And so we asked him to come back, and he graciously agreed. And Dr. Patel, thank you so much for joining us today.
Well, it's an honor, and I was very excited to do this again.
All right. Well, awesome. Well, Defy Nation, you may remember from last time that Dr. Patel graduated in the top 10% of his medical school. He's also published, and of course, in my opinion, the coolest thing is that he was a team physician for the University of Colorado and Denver University. You are just awesome.
Well, thanks. It was a great time and lots of good experience from that experience.
Okay, well, let's get right into it because we have a ton of questions that Defy Nation wanted to know, and so I want to just get right into it. And I want to get into knee injuries specifically. So many people have them, so many people have knee pain, and last time we had discussed how, really the hips, the strength of the hips and the abdominals really contribute to reducing that and trying to prevent some of that injury. But I want to go into something a little bit more specific. One of the questions that we had sent in was about dislocations. Now, can you tell us what exactly is a dislocation of the knee, and what kind of healing time can a person expect if they experience that?
So dislocations of the knee actually involve two categories. The more common lay term dislocated knee actually refers to the kneecap dislocating. So again, from our last conversation, the kneecap actually sits in a groove, and when the knee turns in a certain manner or is hit, the kneecap will pop out of that groove. And that's more commonly what everyone refers to as a knee dislocation. And healing time for that, depending on if there's any cartilage injury or not, can be anywhere from 2 weeks of immobilization, meaning putting in a knee immobilizer and then gradually doing some range of motion, to potentially even surgery if there's a cartilage injury or a piece of cartilage that gets damaged. So that's different than what if you refer to a knee dislocation to an orthopedic surgeon, because the knee dislocation means that the femur, the thigh bone, and the shin bone have dislocated, means gone different ways. And that's a much bigger injury where, if you remember Jason Williams from the Chicago Bulls, he ended his career because he actually had a knee dislocation. And in those injuries, you tear all your ligaments in your knee, basically, the ACL, the PCL. You also tear commonly an artery or a nerve, and basically you can see the difference in severity. And so if you actually have a true knee dislocation, the healing time for that is much more complex and prolonged. So when you hear of people saying knee dislocations, it's more the kneecap coming out of that groove.
Okay, can I just say, ow, oh my goodness gracious, no matter what situation you're in, it doesn't sound good. And, okay, so we don't want this to happen, obviously. What is the best way to prevent them, or is there a way to prevent this specific type of knee injury?
So the actual knee dislocation where the thigh bone and the shin bone go away from each other, that's hard to prevent. That usually happens from a motorcycle or a motor vehicle collision.
Ow.
But the other one, the kneecap dislocation, sometimes your anatomy, the way that the groove is, instead of being a groove, it actually is hypoplastic. It's a term that means there's not much of a groove. And so the kneecap doesn't have anywhere to sit. And you were born that way, and risk factors such as that, increase your risk for dislocation. So sometimes it's preventable, these kneecap dislocations. Again, it goes back to your landing mechanics, your hip and your core strength and your thigh strength. But sometimes you're born with these anatomic variations that is difficult to prevent.
Wow. Well, the abdominals do control so many things in the body, and I have to cut away to a commercial break, but we are going to stay with the knee and some other questions that were sent in by Define Nation about the knee and just some other different types of injuries. Remember, Define Nation, this segment is brought to you by the Farmersville Chamber of Commerce. Family fun, amazing shopping, and unmatched rest and relaxation are calling. What are you waiting for? Start your plans at farmersvillechamber.com. Hey, Define Nation, this is Danielle, and I got to tell you guys that I found the perfect getaway destination that brings harmony, peace, and fun for any family or couple looking for that weekend getaway. Farmersville, Texas is simply the most hospitable, friendly, and charming town you'll find here in Northeast Texas. Whether you celebrate the rich history of veterans in Texas and an all-American hero at the Audie Murphy Festival, check out the fresh harvest creativity at Farmers and Fleas Market, or even get back to the harmony of nature riding your bike, a horse, or hiking through 19 different towns along the Chaparral Trail. Truly a diamond in the rough and made with recycled materials. How awesome is that? There is also a wide array of taste bud tapping unique restaurants along the fascinating and charming historic downtown square with amazing shopping too. Thousands of unique, fun, or antique finds await you there. What are you waiting for, Define Nation? Start making your plans today at farmersvillechamber.com. That's farmersvillechamber.com. Hey, Define Nation, this is Danielle, and you hear me talk a lot about nutritional density on my show. You guys all know the most important essential nutrient is water, but so many of us take it for granted. For me and my family, only one name in water will do, and that's e-water. Since having my home system installed, my whole family has tasted and felt the difference. Who knew my favorite beverage could be better? One of the most surprising aspects is in the shower. My pores feel more open and skin more alive. It really is a unique feeling. Water is the most important element for life, so don't let another day pass without enjoying it to the fullest with eWater home filtration systems. Visit them today at ewater.com. That's EWATER.com. And we are back to Define Nation with our very special guest, Dr. Patel from Baylor Scott & White Orthopedics of Garland. And Doc, we came out of that segment talking about a very painful injury, a dislocation of the knee, and you explained how there were two different variances, but you also gave us some great takeaways about how we can prevent them. Well, at least one. The other one is really more of an accident or motor vehicle is what it sounded like. But we had a significant number of questions that came in about ACL and MCL injuries. So first of all, if you can recap, what exactly is an ACL injury? And more importantly, what are the symptoms that someone might suffer if they do have this injury?
Great question. So an ACL stands for the anterior cruciate ligament, and it's a ligament, so it connects bone to bone, and it connects the thigh bone with the shin bone. And its function is to prevent the knee from moving in a certain direction. It has two functions, which it moves in the forward direction and a kind of a rotational direction. And it prevents the knee from doing the abnormal motion. And so most commonly when someone tears their ACL, they hear or feel a pop, they have immediate pain, and then their knee swells up pretty quickly. And that's classically the symptoms of an ACL tear.
Oh, and that, again, does not sound fun at all. And now let me ask you, the healing time for this type of injury, does it really differ depending on somebody's age? I mean, if, I don't know, a 14-year-old has this injury versus a 65 or 70-year-old, is there a difference in the healing time or really the mobility once they do come back?
So when the ACL tears, they all heal, and they probably all heal in the same amount of time depending on age, but they heal in an abnormal position. So basically, the function of the ACL from preventing those two different motions is lost. And so healing is about the same. However, you lose the function of the ACL. It heals, but not in a good position, and that's why the concept of an ACL reconstruction has come into play.
Okay, and then very quickly, the most common types of activities that lead to this kind of injury, or in your experience, people who've had that injury, what are the most common ways that they suffered it?
Most commonly, it's a non-contact pivoting injury. So you're turning directions, and your knee just gives way. You hear this pop, your knee swells up, and that's most commonly an ACL. The other big mechanism for an ACL injury is being clipped in the knee. So having an injury where someone lands on the side of your knee and your knee bends in, and again, that leads to an ACL tear. So those would be the two big mechanisms.
And the best way to prevent an ACL injury, or does the prevention methods really change with age? Is it just agility and strengthening the muscles around the knee, the quad? What is the best way to try and prevent this injury, or is there?
So most of the research around ACL prevention is circled around young adolescent females. It goes back to what we discussed in our last talk show, was the Q angle and how their hips and the angle of their legs play into effect. And so for these young adolescent females, they recommend this fancy word called neuromuscular training. It's learning how your mind and body connect, as well as the landing mechanism. So if you're jumping off from or a layup, how are you landing? Are you landing with your knees pointed out or your knees pointing in? And so it's targeted mostly on those two things. And again, it goes back with the hip and the core strength as far as those landing mechanics go. And research has primarily focused around prevention in those groups.
And now to clarify for everyone, the difference between an MCL and an ACL, and then what are some of the symptoms that somebody might have if they have an MCL injury?
Great question. So the MCL is an extra-articular ligament, so that's outside the knee joint, and it's located on the inside part of the knee, whereas the ACL is an intra-articular. Basically, the symptoms of an MCL injury are pain along the inside part of the knee. You can also have a pop, but the swelling will be not as severe, and you'll have tenderness to touch along the medial or the inside part of the knee.
Okay.
Whereas an ACL, if you have an isolated ACL tear, you will not have any tenderness.
Okay, so I'm going to pose those same questions to you as we did with the ACL. The healing time, and does it differ depending on the age? And really, what is the best prevention method so you don't get this injury?
Yes, great question. So MCL, they all heal, typically. So there's 3 grades, grade 1, 2, and 3. And it goes with severity of injury, so 3 being the worst and then 1 being the least. And most of the time, you could treat an MCL without surgery. The healing time can take anywhere from 3 to 6 weeks. Sometimes you get some lingering pain along the MCL, but typically they all heal. The younger you are, I feel the quicker to heal. And basically, you very uncommon to have surgery for an MCL injury in an isolated setting.
Okay, so as far as prevention methods...
So the prevention, there's been some studies that look at linemen and using knee braces and preventing MCL injuries. But other than that, most MCL injuries are traumatic, means from an injury during a sporting event or a car accident. So it's very hard to prevent an MCL injury.
And really, if somebody's getting a brace, they should get a professional opinion, not just go to their local sports store and, kind of stare at the wall and,
Absolutely,
ask what it is, right?
There's so many different types of braces, and you can actually get overwhelmed with it. And just having a little guidance on which one would better fit you for what your goals are, will save you time and money.
Okay, so now we talked about really the inside and the outside of the knee. So how exactly does the patella play into this, and why is it said to be the most fractured part of the knee, or at least the last that I heard according to orthoinfo.org?
Yes, and so the patella doesn't really play into effect with MCL and ACL. It has its own spectrum of injuries. It basically, if you think about a tug of war, it has people pulling in 4 different directions, to the outside, to the inside, to the top, and to the bottom. You have your quadriceps tendon, you have your patellar tendon, and on the outside and the inside, you have other little ligaments that are keeping your kneecap in position. So most of the time when your kneecap or your patella dislocates, you've torn those ligaments, and typically you don't have an MCL or ACL with it. And as far as it being the most common fractured bone in the knee, it's because it's so superficial. It means it's right underneath the skin, and majority of the time when you fall, you land directly on your kneecap and you break your kneecap.
Okay, so real quickly then, what is the difference between a fracture and what they call an unstable kneecap, and what symptoms would somebody be able to tell them apart?
Very good question. So an unstable kneecap means that the kneecap is not staying in that groove, and that's because you've torn a ligament, and that ligament is not helping to even out the tug of war. So one side is winning over the other. Whereas, a fracture is the kneecap, even though all the ligaments are intact majority of the time, it's in pieces, rather where an unstable kneecap, it's still in one piece. The symptoms can be a little similar with bruising, swelling, and tenderness to touch, but with an unstable kneecap, you'll know that the kneecap pushes out most commonly to the outside part of the knee, and you'll have a bigger deformity with that one.
Okay, well, I tell you what, we are going to come right back to the knee. I need to go to a commercial break. I'm so sorry, but we're coming right back. And remember, Define Nation, this segment brought to you by the Lexington Medical Lodge. When sincere and personable health care for your loved one matters, choose Lexington. Visit them today at LexingtonMedicalLodge.com. Hey, Define Nation, this is Danielle. We all have people in our lives who we love and only want to give them the very best in care as they age. Lexington Medical Lodge in Farmersville, Texas has a sincere and personable staff to care for your loved one. In designing the facility, they actually studied the resort and hospitality industry for inspiration. Wow! Lexington Medical Lodge combines the industry's latest treatment techniques and equipment with a highly personalized approach to care. This patient-centered combination of technology and skilled care enables their rehabilitation guests to return home as quickly as possible, along with providing their long-term guests with enhanced well-being and quality of life. And you know I'm a fan of quality of life. Visit them today at LexingtonMedicalLodge.com. That's LexingtonMedicalLodge.com. Hey, Define Nation, this is Danielle, and finding nutritional density in snacks these days can be a real challenge, especially for the little ones in your world. When I reach into my pantry, I grab a bag of Wonderfully Raw. Whether it's their Cocoa Rune, Brussel Bytes, Dippers, or Snip Chips, I know both my taste buds and my hunger will be satisfied. See the wide variety of flavors sure to please all members of your family at mycocorunes.com. That's mycocoROONS.com. And we are back, Defy Nation, with our very special guest, Dr. Patel from Baylor Scott & White Orthopedics of Garland. And we got a lot of information in on that last segment. But another question that had come in is, what exactly are femoral neck fractures of the hip, and are they related to the ACL, MCL, or patella injuries?
So femoral neck fractures are, if you look at the hip joint, it's a ball and socket joint.
Okay.
So the femur neck is just beneath the ball. And basically, so if you have a femoral neck fracture, you fractured right below the ball of the hip joint.
Ouch.
And so, yeah, it's one of the most painful fractures you can get. Further, it's not really related to an ACL or MCL or patellar injury. It can be in the same setting with a motor vehicle collision where you have a knee dislocation, you tear all those ligaments, and you fracture your hip. But commonly in athletes, young adults, they don't fracture their femoral neck and not really related.
So why are these type of fractures so overlooked?
In my experience, I don't think they're overlooked. Most commonly, these fractures occur in the age range greater than 60 and in elderly females who have osteoporosis. So
Okay.
maybe the idea there is stress fractures are overlooked because sometimes athletes come in with groin pain or hip pain, and what happens is you get an x-ray and the x-ray is negative, and then ultimately you do some physical therapy or some conservative treatment with anti-inflammatories or ice, and then pain doesn't go away, and then you get an MRI, and then you say, oh, wow, there's a stress fracture of the femoral neck, which is more common in the younger athletic population.
Okay, so I heard you say osteoporosis there, and I was just about to say, so I guess this is more common with older adults, but you're saying it's more common with younger adults.
So femoral neck stress fractures are more common with younger adults.
Okay.
Actual fractures are more common with the older adults with osteoporosis or weaker bones.
Okay. Well, moving on to our next topic here. We had a listener that emailed in that wanted to know exactly what is an Achilles tendon rupture and why are they so misdiagnosed?
So the Achilles tendon, if you look at your calf, it has this muscle belly called a gastrocnemius and then another muscle belly called a soleus, and that comprises the calf muscle. And that, as it goes down to the foot, those two muscles come together and create a tendon called the Achilles tendon. And there is an area of the Achilles tendon that has a decreased blood supply, and so commonly these injuries occur to weekend warriors who go out and just have a lot of activity one weekend and rupture their Achilles tendon in that area that's weakened. And it's not used to seeing a lot of work and stress. And they are commonly misdiagnosed because, one, when you have that injury, you feel like someone kicked you in the back of the leg. You feel or hear a pop, and then 5 minutes later, your pain goes away. And so people think that, it's just a muscle tear, etc. But you'll know if it's a large enough tear that that Achilles tendon will have a gap in it. So you'll be able to actually feel a gap. You won't able to what we call plantar flex or bring the foot down to the floor. And those are two things to look out for.
So what exactly is the healing time on this type of rupture, this type of injury? Does it always require surgery? Is a secondary part to that question.
It doesn't always require surgery. There have been several good studies out there that show that Achilles ruptures can be treated non-operatively, but you have to get to them early enough, and basically you have to splint them in the correct position.
Okay.
And if they're splinted in a correct position early enough, you can technically treat them non-operatively. But unfortunately, sometimes, like you said, they're misdiagnosed, they're not splinted in or placed in the correct position as far as the foot positioning, and they show up a week or two later, and then you have a discussion with the patient regarding it, and commonly requires surgery.
Okay, so you said that this is a weekend warrior, or most of the times when this injury happens. So it is something that could be prevented, correct?
Yes, and it can be prevented by gradually increasing your activity level. and ensuring that your tendons, and not only your Achilles tendon, but the other tendons in your body, aren't going from 0 to 60. Maybe go to 0 to 40, hover at 40 for a little bit, and then push it to 60.
Okay, so kind of related to that, what exactly are shin splints, and why are they such a common complaint, especially along, with those that are active?
So there's two groups that shin splints happens in. Those that are super active and have no time for rest, and then the other group is, again, the weekend warrior. They go from 0 to 60, where they really need to gradually get to that 60. And it's a stress reaction of the bone and the tissue around the bone of the shin, because it's seeing an abnormal amount of stress and too much. Your body can actually accommodate for stress, but it has to see it over a gradual period of time and not just immediately.
Okay. Well, I got to tell you, this show has just flown by, Dr. Patel, and I have to ask you, would you flatter us with one more show, a couple more segments, because we have so many questions that came in. I really want to get to them, and what can I say? Define Nation loves you.
Well, it's my pleasure, and I would love to be back.
Awesome. Very good. Very good. Well, Define Nation, remember, we are going to post a trivia question from today's show on our social media outlets. And if you answer it right, you're the one that gets your hands on that $500 prize pack. Until next time, Define Nation, motivated, dedicated, and highly recommended. Bye-bye.
For 20 years, Nordic Naturals has been dedicated to making the best fish oil on the planet. Their motivation? The heartfelt belief that a single nutrient can change lives. Their love for what they do and the people they do it for drives them to do it right at any cost. That means products that are outrageously fresh, obsessively tested, and passionately perfected. Products that taste so pure, you'll love them. Try Nordic Naturals award-winning omega-3s today and taste pure love. Available at natural product stores nationwide or at NordicNaturals.com.